This is Dr. David Klein with Stages of Life Medical Institute. Today, this moment, we're going to discuss, again, telehealth visits and what to expect. How are they done? What does it look like from your perspective? A telehealth visit is little more than a video conferencing call. So you call in, the doctor's on the other end of a video camera, and you try to exchange information. A lot of the information you're going to be asked, it's best that you have it handy and ready to go because it's difficult to do this under the best of circumstances, and if you're prepared, it's going to work a lot better. You need to have your vital signs ready to go. That means a temperature, very important, your weight, very important, pulse. Those are all things that you can do without a lot of equipment. But the blood pressure is going to be necessary at some point. So go out, get yourself a cheap blood pressure cuff and keep it in your house. It's important, and it may become more important in the future as these sorts of interventions become, let's just say, more mainstream. So what do? You call into your doctor's office and try to set up a telehealth visit. Most doctors right now are trying to get this thing done, scrambling to get it done. By the time this thing is disseminated, more doctors will be able to do it, and it'll become a little bit easier. The platform that's used can vary from some embedded telehealth in their EHR, that's a healthcare record. Those tend to work a little bit better for some of the EHRs, and it works badly for most of them. So what most doctors are doing right now is they're jobbing it out. They're using outside software to make this thing happen. The one that we use is called Zoom, Z-O-O-M. Why? Because it's easy to set up, it doesn't cost a fortune, and it makes it easy to operate two platforms at once. It's very much like FaceTime, except you have something that FaceTime doesn't give you, which is called privacy. So when you use FaceTime, it's easy for the docs because they're used to talking to their kids or grandkids, but privacy, you might as well forget it. Okay, so this is not the way we do it, and it's not the way I recommend that you do it. Zoom works fine. Now, when you call in, you need to square yourself off against the camera. The doctor needs to look at you in the eye. Okay, so it doesn't do you a great deal of good to be carrying your kid, walking around, and trying to get the job done. It's not going to happen. So the way we do it, and if you're a doctor listening in, we send our patients an email giving them the crayon book version about how to log in, how to use the software. So I have my graphic artist putting it together. We send an email out in advance. Then you send your patient, your client, your customer, whatever the situation might be, an invitation. They're ready, waiting at the appointed time. They accept the invitation. The software loads on their phone or loads on their computer, and then everything happens. Now, what does it cost? The cost for this is the same as an office visit, so you're not going to get a break on this in terms of the finances. If you think it's a freebie, forget it. You're paying for the doctor's time and expertise, not necessarily for the magazines in the waiting room. You don't even get donuts at a doctor's office any longer, okay? So who is eligible? Right now, all Medicare patients are eligible. That's awesome. Why? Because they finally got around to approving it. This took a national emergency to do it. How long will it remain that way? Remains to be seen. If you have commercial insurances, they don't typically cover this type of office visit with your doctor. They do give you a little bit of a head fake. You can call them up on the telephone and talk to a nurse, maybe, a PA, maybe, and get some answers. Okay, they're trying to keep you out of the hospital. They're trying to keep their costs down. Doesn't necessarily mean they're delivering quality anything, because you need to have a look at the urine. You need to have a look at the patient, a good look, in order to start antibiotic coverage. So if you call, I think I have a urinary tract. Okay, I've done this 42 years. Some of the time you're right, and much of the time you're not. Okay, it really does pay to run the urine through the analysis machine. It really pays to get a feel for the nodes in the neck, to know whether or not you have strep throat or a viral upper respiratory tract infection. So is this a good idea? I don't know. It's an idea. It's something that we're going to have to do. I'm not crazy about getting used to the idea, but that's just the way life is. So there's no savings on cost. I'm afraid for quality issues, but we're doing what we have to do, especially in times of trouble. So this is Dr. David Klein with Stages of Life Medical Institute. We are, in fact, taking new patients right now by telehealth. So we can cross state lines with this one for the time being. existing patients, we can continue care after the emergency is over. In fact, we can do it for people out of state after the emergency is over. We're happy to help any way we can. If you're a doctor, we're only too happy to help you we'll give you advice how to set yourself up. It's a big country, lots of people out there. We're not in competition with you. All right, so we'll help you any way we can. Again, this is Dr. David Klein. Thank you for tuning in.